As a woman, you no longer need to suffer with menopausal symptoms like night sweats and hot flashes. You've been lied to in regards to the safety and efficacies and risks regarding hormone therapy as a woman, and we're going to take a deep dive into all of this here in a bit. Not replacing your lowered levels of hormones even before menopause, but especially through peri and actual menopause, literally is guaranteeing that you will suffer for years and years when you don't have to because of this amazing bioidentical therapy that's been here this entire time. Trust me when I say this. I have clinics that service across the nation, and I work side by side with some amazing women's healthcare practitioners. They handle the prescriptions and the hormones and all that, and I handle the coaching, and we have a high level of success when it comes to balancing our women out, optimizing their health with hormones, and achieving lasting weight loss too as well. There was some massive studies done, specifically the Women's Initiative trial, that scared the world into thinking that the hormone therapy was not ideal and it was dangerous. We're going to break through those barriers and help you understand why those studies and why that study was a load of shit and why you deserve to be living much higher quality of life and you don't need to suffer. Let's get into it. Let me start by sharing with you just a brief story, what actually got us into bioidentical hormone therapy. So my mom, this was about a little over 10 years ago, was in menopause, and she was suffering with the worst night sweats and hot flashes. I heard it from my dad. I heard it from her. They were looking for options. She was getting no answers. And so I dug into this, looked into it. And, at that time, my clinic was focusing on functional health, but we hadn't looked at hormone therapy before, especially for women, because what I had heard is it's more dangerous for women. After spending some time digging into it, realizing what a load of crap that is and how efficacious and safe bioidentical hormone therapy is, and we're going to get into all that, put my mom on it, and within weeks, her night sweats, hot flashes came to a calm. Her quality of life improved dramatically. She was brain foggy. She was tired. She even had some frozen shoulder going on too, which is, you wouldn't think about frozen shoulder and musculoskeletal issues, but the list of menopausal symptoms is still growing. So completely transformed my mom's life. And since then, we implemented in our clinic, and we've helped thousands of women across the nation just like her. Okay, so I love this, the 7 menopausal dwarfs. So this is such a powerful slide because, first of all, it's funny, but, itchy, bitchy, sweaty, bloaty, sleepy, forgetful, psycho, and look, massive mood swings, anxiety, depression, tiredness, brain fog, cranky, irritable. That's the bitchiness. And the sweaty comes from the hot sweats, the night flashes. Like I said earlier, the list goes on. In fact, let's take a look at another list here, because I really want you guys to understand just how many freaking symptoms a woman can potentially deal with as she moves through menopause. So these are the most frequently experienced symptoms and conditions. And what I love about this chart here is you see testosterone, estrogen, and progesterone. And I know you might be thinking, why is testosterone on this list? Testosterone plays a huge impact, and we're going to get into this later. But the color coordination allows you to see that a particular symptom or issue has sometimes, in many cases, 2 or even all 3 hormones, the deficiency of them contributing to this condition. So again, we look at the estrogen, the sensuality. This is where we're losing our femininity. We're not able to have intercourse as well. We're not lubricating as well. We get that vaginal dryness. With the testosterone, our motivation, our energy, our brain fog, and then of course progesterone, we're not sleeping as well and we're irritable. So again, this is a laundry list, and even the most recent research tells us that we're seeing more and more symptoms, both mentally and physically, that we contribute to a decrease in sex hormones, both in that perimenopause and of course menopausal state. Okay. So what is menopause? So menopause is actually clinically diagnosed as a point in a woman's life when she hasn't had her period for the past year. Okay. So now what is it really supposed to represent? This is like, we're laying down the gauntlet. We are no longer able to ovulate. We are no longer able to have kids, right? So this is a monumental point in a woman's life. And what's really interesting is when you look in the animal kingdom, most animals, they don't have a menopause. They don't have a post, but they die. This is when the female can no longer breed, the species ceases to exist. And it's very, very interesting. But researchers have actually identified a few species that have this similar pattern where the female continues to exist. So we're still unraveling and learning more as we can from the animal kingdom and applying what we can to us. But menopause is real, and women do continue to live. But unfortunately, as we've discussed and we're going to continue to get into, they suffer. And the amount of women in this world, 1/3 of all women are dealing with these menopausal symptoms. So let that sink in for a minute. This is very, very far sweeping, far extending. These symptoms are extremely disruptive to daily routines. And the thing about it is this, like, why this is such a unique situation is because, look, menopause is not the only condition that produces disruptive symptoms. In fact, there are conditions that produce much more disruptive symptoms, right? For example, a cancer patient undergoing radiation treatment, right? We know how disruptive it is to the caregivers around that person. But what's different is we know what to expect there. Like, there's no controversy, there's no lack of understanding. But what's so unique about menopause for women is the fact that we haven't been talking about this for the last 50 years. And women have just literally been suffering and have been made to feel like the problem is with them, right? No one's really recognized it. And again, that's that women's initiative health trial that really just screwed things up for women out there. But the fact that there's a lack of awareness, both from clinicians and people alike, is why women were literally made to feel crazy. And so if you are a woman watching this right now, you are not crazy. I understand. My women's healthcare practitioners understand, because we've been doing this with them for the past decade, and we've seen nothing but monumental improvements in overall quality of life. Okay, so the horrible mismanagement of women. Man, this Women's Health Initiative trial by the National Institute of Health, NIH. So before we even get into the study, understand that between the 70s and 90s, treating women with hormones, specifically estrogen and progesterone, this was accepted. This was understood. We observed a phenomenal improvement in quality of life when we gave women these hormones, right? A huge reduction in the need for medications. But and does that have any sort of play in relationship to what happened here? I don't know. I'll let you guys decide by the end of this video. But so finally, in the early 90s, the NIH said, hey, we've never really studied this. So let's try to figure out what's going on, the safety and the efficacy. And so they started this biggest study that was ever done, looking at women and hormones. To quote Dr. Peter Attia, which is one of my mentors, and if you guys don't know him, follow him on the Drive podcast, but he is a powerhouse of knowledge. And literally, you can catch him saying that this might be the very biggest gross negligence that has ever been done, in his opinion, in the healthcare community. And I think that says it all. And I would agree with him because of what we're just about to get into. Okay, so what they were trying to say, what they were trying to accomplish is, hey, are these safe? Let's figure it out. There was massive problems with the design of the study right from the get-go. So number one, if you're truly trying to look at women in menopause and figure out what's going on, then you start the study on women that are just starting menopause. They looked at women that were 10 years or later after menopause. So very unrepresentative. Number two, they looked at women that were extremely and very unhealthy. This wasn't a representative population that we can then apply to. They were, again, and look, their rationale was, look, we want to see death so that we can get a better idea of what's going on. So they chose an unhealthier population, and they chose older women that were 10 years or later past menopause. This third one, though, is wild. So not the most wild one, but they did the study on asymptomatic women. Are you following this right here? We're trying to figure out if hormone therapy is safe or not. In the real world, we're not treating asymptomatic women. But their logic was, well, look, if we treat symptomatic women, then the people that were going to be randomized to the asymptomatic group are probably going to drop off the study. And while that does make some sense as far as the study, it makes no sense at all when it comes to applying the data into the real world. So if you think that's the biggest screw up from this study, you'd be wrong, because the biggest screw up, and this one is the one where I go, was this a screw up or was this intentional? Drop me a comment. Tell me what you think if this is not the first time you've heard this story, but I'll leave it at that. They didn't include bioidenticals in this study. Okay. So to me, that is just the biggest screw up, hands down, because we know that bioidenticals are safe. We haven't seen issues, and we have plenty of research since this study that has shown safety levels when it comes to bioidentical usages of progesterone and estrogen, but they didn't, and again, their rationale, well, more people are using the synthetics like, for example, the medications Prempro and Premarin. Prempro and Premarin are synthetically derived from horse urine. All right. So they happen to be molecules that will act on the estrogen and progesterone receptors, but biologically, they are very much different than the natural estrogen and progesterone in our bodies. So when we say bioidentical, we literally mean under a strong enough microscope, you would see a biologically identical compound. Bioidentical. That's a key term because we know how safe that is, yet they didn't include that in the study. So now I think what we learned from the study is still very valuable. What we did learn is how dangerous and how, I mean, we're literally breast cancer, cervical cancer. They had to stop the study because of the complications that were arising. Complications that were arising from synthetic hormones, right? Not bioidentical. And just to put the cherry on the cake here, ladies, before the results were peer-reviewed or even published, they had a big press conference, they met, and all of a sudden, within days, there was headlines everywhere, HRT causes breast cancer. And this was a far sweeping movement, and it changed history as you know it. Medical practitioners used to get training in HRT when it came to women. They don't. They stopped getting training in HRT because it was just automatically assumed that you would never do this, or it would have to be an extreme situation where the benefit would definitely outweigh the risks. And so there was still very, very small usage, but because the risks were so high, it was very rare that practitioners ever, for the last 50 years, last, I guess, 30 years, helped women. And instead they just suffered. So conjugated estrogens, or we're talking about synthetic estrogens, are sodium based, and they're only about 6 to 8% identical to the body's natural hormones. So this is, again, why we saw such, and we're not saying everything that's not bioidentical is going to be dangerous, but I think what we can conclude is the more it deviates from the natural structure, the more potential for problems that can arise. Again, cervical cancer, blood clots, stroke, heart disease were all noted in the Health Initiative trial. Oral hormone replacement therapy cannot produce the same physiological levels. That's the other thing too, is we know not to use oral estrogen because it increases blood clotting, yet they still did it in the study. So the damage and the implications that arose were probably billions at this point, I would say above millions, of women that have suffered for the past 30 to 40 years because of this study right here and how we chose to react to it. And again, was that by design? I'm just going to have to leave that, guys, up to you. So there was a 10-year study done between 1992 and 2002. It wasn't massive, but it was just shy of 1,000 women. And they were given bioequivalent, bioidentical hormones. And we didn't see issues. We didn't see cancers. We didn't see problems. Even the one reported case was accounted for in terms of what we saw and how long they had it and the type of cancer. So, and there's many more studies. There have been many more studies that have came out since the WHI that have shown efficacy and safety with bioidentical hormones. But again, what the powers that be might say is, well, they're not as strong as studies and as robust as the WHI. And while that technically is true, it still begs the question, why haven't the proper studies been done when we know there's a therapy in front of us that potentially could prevent billions of women from suffering every single day for several years? Because that's how devastating the implications of menopause can be. Okay, so why is menopause hitting you so hard? Okay, so I think this is important to understand, and I think this chart, there's a lot going on here in this chart, but let's dive into this. So on the perimeter, you see various sources of contaminations: food preservatives, products, personal care products, plastics, manufacturing, residents, packaging, clothing, pesticides, solvents. Like, there is a well-documented and known problem right now for humans, which is the ever increasing exposure to toxic shit. Pardon my French, but this is the problem that we're aware of. And, you know, I guess we're trying to do something about it. I'm not quite sure, because these companies continue to make these quote unquote mistakes, and human beings are paying the cost. So specifically, we're talking about EDCs. Now, if we look at the middle, endocrine disrupting chemicals. So your endocrine system is your system of glands that are responsible for making the hormones that have the awesome benefits of improving our quality of life. Okay. We'll talk about specific hormones here in a little bit, but there are many known EDCs, but I want to get into just some of the big ones here, so you guys can understand just how devastating these EDCs can be. Phthalates. So phthalates have been shown to have toxic effects on reproductive health, including developmental malformation. So we can see here on the chart, there's a couple different exposures of phthalates: personal care products, plastic, various plastics, and manufacturing resins too as well. So phthalates have this known potential for full-blown developmental malformations just from exposure to a chemical from our various products that we're being sold to every single day. Now we have BPAs, which are short for bisphenols. So BPAs and phthalates can have a lifetime effect of lower endocrine function from pregnancy exposure. As you can see in the study right here, the exposure is extremely high. And so I want to be clear, right? So it's one thing for toxic crap to affect us in the moment that we have exposure. For example, mold in a house can derail your health. But when you remove the mold, you do a little bit of cleanup, you can recover. But we're talking about essentially, in many cases, permanent damage from exposure to mom and eventually exposure to the fetus in development, which then has a lifetime of consequence for the newborn, to where their ability to produce these amazing hormones for quality of life have been compromised. So that to me is insane, but that's how powerful some of these chemicals are. Finally, PFAS, perfluoroalkyl substances, which we see these in clothing, we see these in furnitures, we see these in food packaging products. These have been associated with hormone disruption and lowering testosterone levels, as you can see in this study. So I could sit here and go on and on and on, but I think you get the point. There is a massive amount of toxicity in our environment, and we should be doing everything we possibly can, right? We absolutely should be doing everything we possibly can to avoid these toxic chemicals to the best of our ability. But a lot of these chemicals, some of them, they last in your body a lifetime because of how slowly they break down. So the reality is we are not going to be able to avoid a lot of these chemicals. And so what are we supposed to do when we already know how devastating lower levels of these awesome sex hormones are for quality of life. And now we know and better understand that we are being exposed to toxic crap. What is the solution? And you guys will be learning here and as we continue on. Okay. So I like this little graphic here because this shows the goal, the idea here, replacing your hormones, right? Supplementing with external or exogenous hormones, hormone replacement therapy. Now, specifically, we want to be clear. This is bioidentical hormone replacement therapy, or BHRT. So BHRT is the form of therapy that we've known this entire time, works well, is very safe, and it's unfortunate because of what happened. And, we've already got into all that. But if you look here on this graph, we have higher levels of hormones when we're young. And as we age, we do notice a decrease. So we have two things that we're considering here. We have the natural rhythm, right? The natural cycle is to have higher hormones when you're older, and the levels decrease as you age. With women specifically, there's a marked decrease in menopause, right? But then overlapping that, we have massive exposure from these endocrine disrupting chemicals, which is throwing our systems through something that we probably won't fully understand until the next 40 years when we can look back and see how screwed up everybody is then now. I mean, quite frankly, the state of affairs right now with our healthcare system is already pretty freaking bad. So if you look at the green bar there, we at some point, usually, mid 30s, I would say, is sort of that average age where when people ask me as an individual, when should I be considering hormone therapy, man or woman? Generally speaking, I say mid 30s. And let's not get it twisted here for a second. I've helped many people in their late 20s who had sex hormone levels that were so low that they were living such an awful quality of life, getting no help from the primary care system, from their primary care physicians, and needing to get on hormones at a young age. And we'll get into all the ramifications of that later, but getting the hormones back to just an optimal level, that's the goal of replacement therapy, BHRT. The goal is to get your levels back to optimal, right? Optimal is the top end of a range. This range, unfortunately, has been very skewed and very messed up, and there's kind of a lot that goes into that. So these reference ranges, unfortunately, are not a representation of what your hormone levels should be ideally. It's too expensive for laboratory reference ranges to give us that. Instead, these reference ranges are what we call a standard deviation. It's a comparison of you to everybody else in the same gender, in the same age bracket, in the same area. So these deviations essentially let you know where you stand in comparison to this group. And unfortunately, when you have a problem like this, where there is overall decreases in hormone levels in this particular category for women, the deviation gets screwed up, because telling you that your levels look good is simply saying you look good compared to a group when the entire group is plummeting, right? So we have to take that into consideration when we look at optimal levels. And this is impacting men and women alike. Okay, so what is a hormone? Very simple. It's a chemical messenger. It is produced by glands in your body, and these glands produce this chemical. It floats around the bloodstream, and the presence of this hormone in your bloodstream is activating certain organs, certain tissues in other parts of the body, which turn on various processes. And this is what contributes to high quality of life. And without activation of hormones, this is where we see a laundry list, like you saw earlier, of various symptoms that manifest and develop simply due to a lower level of sex hormones. Think about how many freaking medications, ladies, if you're listening to this right now, that you were given for your anxiety, for your depression, for this, for your shoulder, for your pain, which probably would have gotten better had you been given this opportunity to just get on some bioidentical hormone therapy. I can't even stress how much of an impact BHRT therapy will make. So estrogen in women contributes to sensuality, right? Estrogen is what makes a woman, right? So, and we say testosterone is what makes a man, but the funny thing is men need estrogen and women need testosterone too as well. But a higher amount of estrogen relative to what a man would get is what makes a woman a woman. And a higher amount of testosterone relative to women is what makes a man a man. So these are still powerful hormones that are producing this desirable effect, right? Lubrication in the vagina, better experience of orgasms, a better experience of intercourse overall. The depletion of estrogen, right? Which is, again, we know menopausal, the process, menopause, when this starts, this is where women start to experience a decrease in their overall femininity. I wanted to interrupt for a quick second and tell you guys about the free weight loss plateau busting guide that you can get. I'll link to it in my description, guys. I break down the exact steps of what you need to solve that dreaded weight loss plateau, and more importantly, how to prevent it. Now back to the show. Okay, so progesterone, we can think of progesterone as the counterbalance to estrogen. So progesterone is the more of the calming, the relaxing, the anti-anxiety. Progesterone's a big deal. We know that giving a woman estrogen, even bioidentical estrogen without counterbalancing with progesterone, is actually problematic and can be dangerous because of due to thickening of the uterine wall. So we have to have a good balance between estrogen and progesterone if we are looking to provide safe and efficacious therapy. Look, and it's always so funny. Like I have, if you were to work with our clinic, I have women's health practitioners, and men don't seem to care whether they work with a man or woman. And I think it makes sense because men are just easier to balance. They have a 24-hour hormonal pattern. Women, on the other hand, have a 28-day pattern. And while there's plenty of men that are extremely qualified to work on women themselves, I think there's something special about the woman having experienced this herself, having lived several decades through a cycle. I think it just gives them a lot more appreciation for the balancing act and just how much more particular it is. It is much more difficult to balance a woman out in hormone therapy than it is a man, period. Okay, testosterone is not a male hormone. Testosterone is so important for quality of life for both men and women. And the amount of literature that's coming out in terms of the health benefits that come from testosterone, they just continue to pour out. But we always associate this sort of like manliness. And again, like I said earlier, men have estrogen, women have testosterone. It's just the right ratio. And so when women have low testosterone, they will get almost all the same symptoms that a man will get. Brain fog, lower energy, sometimes increased anxiety, depression, lower sex drive, lower motivation, lower confidence, decreased positive responses from their workouts and weightlifting sessions. So the list goes on. So women in this balancing act should always have testosterone levels checked too as well. And if you're already going to give a woman estrogen and progesterone, why not bring their testosterone back to a good, healthy, optimal range so that we can really give women a chance to have the quality of life they deserve? As we talked about, the laundry list of symptoms is very high with low testosterone: hypertension, cholesterol, weight gain, shifts in body composition. We've talked about sex drive and decreased sexual function. Quality of life, to me, that comes from the less sex drive, the lower sex drive, the lower motivation, the lower confidence, just kind of that sort of apathetic tone, right? Testosterone makes a huge impact. Now, osteoporosis, I think, is very much worth talking about. So first of all, as a woman, when you go through menopause, we have to be worried about osteoporosis, a condition in which the bones get weaker. So this is going to happen. And the most powerful thing that you can do to offset osteoporosis is resistance training. When you lift weights, your muscles have to pull on bones, and bones act as the levers to give the muscles an ability to contract and produce the movement. That pressure produced by the muscles from when you lift weights produces a signal in the bone to stay strong and to even get stronger. And so why I mention that is because testosterone therapy in conjunction with resistance training will significantly enhance the results. And specifically, my postmenopausal Caucasian women, you guys have the highest rates of osteoporosis. And so, I mean, all women should be resistance training, and all women should be considering BHRT and my therapy if they're suffering and showing symptoms of deficiency. So putting it all together, our sex hormones, our sex stimulating hormones, estrogen, progesterone, testosterone. At the age of 30, we see a diminishing rate somewhere between 1% to 2%. We notice weight gain. We still have some control over it, but we notice. And then when we hit this switch where all of a sudden menopause hits us, ladies, let me know if this sounds all too familiar. You have, as you aged, still had control over your weight. You knew how much exercise you needed to do. You knew how much effort you needed to put in, and you'd be able to lose the weight. But then all of a sudden menopause rolls around, and now it's like this switch was flipped and you didn't change much. And maybe you are either gaining weight uncontrollably or you just can't lose anymore. Let me know if that sounds all too familiar, because this is one of the classic hallmark things that we see with menopausal women. So the laundry list is huge, but I just wanted to summarize it. Depression and mood swings, even bipolar. Remember, I told you the list of menopausal symptoms is growing. They've even added bipolar as a potential complication that can arise from simply having decreased sex hormones in your body. The night sweats, the hot flashes, we know how horrific those are. The lower libido, lower sex drive, the fatigue, the gaining weight. And we're going to spend some time talking about weight loss, because obviously, if this is not your first time watching, you know that this is what we specialize in. But the hormones and the weight loss, how they work together, stay tuned for that. We're going to get into that here in a little bit. Painful intercourse, a medical condition known as dyspareunia, in many cases gets better when we add estrogen, when we give the hormone that's primarily responsible for producing the lubrication necessary for good sex is given right back to the body. Life-changing results can await you. I mean it when I say that, because we've helped thousands of patients do just that. When looking at obese patients, men and women, virtually every obese patient is found to be deficient in testosterone. So we have to understand, when you start testosterone therapy, you may gain a couple pounds, but if you are performing, and there could be a little bit of water weight that you gain, but when you start resistance training, for example, the addition of muscle mass is extremely beneficial and ideal for optimal health. And so you don't freak out, because what we're talking about is fat mass. So we always see lower levels of testosterone as men and women gain weight, especially when they hit that category of obesity, whether or not it's the obesity that caused the low hormones or the low hormones that cause the obesity. Truthfully, in my opinion, I think they're intertwined and help us get out of this process. We need to replace the hormones, but we also need to lose the body fat. And truthfully, I'd even go as far as saying, if you are obese, you might even do better by getting the body fat lower first, or starting that process before you start hormone therapy. And here I am, the owner of a clinic that provides hormone therapy, but I care most about giving you guys the best quality of life. And it can be problematic if you're going straight to hormones without the intention of dropping body fat. So for us, we look at it from two perspectives. If we got a real serious patient that's ready to drop her weight and start hormones at the same time, okay, fine, we might consider that. But we let them know problems will arise if you stay overweight. If you just jump on hormone therapy and feel better on the short term and not make intentions and change your lifestyle, which we provide coaching for our women, the problems can arise within a couple months after starting. And so we really want to use the hormones as a tool, right? It is a long-term tool, because you will need to stay on hormone therapy, but it does improve quality of life so much that it makes it then easier to implement better lifestyle choices to move the needle of weight loss, but also get us more stable in a better quality of life situation. So the WISHES study looking at hyposexual desire was a really powerful study looking at low sex drive, and they indicated that a large, statistically significant decline in health status, particularly mental health, social functioning, vitality, and just overall quality of life decreased with low sex drive. And I think, like, when we look at this, it makes sense, right? Like we can understand conceptually why that is, but I really want to drive this, right? A sex life is extremely important for quality of life for so many reasons. The bonding between you and your partner, the oxytocin that gets released, and the feel-good hormones, and the relationship. Sometimes it's the sex that can be the lubricant for spouses to break through barriers of certain stressful situations where there's no agreement at all. And I know this happens to couples at various points in their life, but that sex can be something that brings you back together and reminds you what matters most, which is your love for one another. So the inability to no longer have that drive or even perform, right? Because remember, this isn't just a low sex drive issue. There could be the sex drive there, but there could also be lack of lubrication in women too as well, which would be an inability to perform, just like a man having erectile dysfunction. It goes in both categories. So fixing this, working on this, protecting this sex life is an invaluable investment in your relationship and ultimately your quality of life. So the mental disorders, the anxiety, the depression, this is so important to understand. We have seen so many women report to us that they no longer needed their anxiety medications. They no longer needed their depression medications. Our philosophy in my clinics have always been reducing prescriptions, preventing surgeries, restoring optimal health, but at the same time, better living through science. And because some really functional clinics and practitioners think that using external hormones is unnatural, but it's also unnatural to be exposed to the ever increasing list of toxic shit that we're all being exposed to, and it's growing. So we got to use science to help us. And I think hormones is one area that we absolutely should not miss the boat on and optimize. And these anxiety issues, these depression issues, because of the WHI, because of what practitioners, the lack of training, well, they stopped getting training, and the awareness and the fear and the concern, it wasn't even on the table anymore. So countless women were prescribed anti-anxiety medications, antidepressant medications, and a whole laundry list of things, because we even mentioned bipolar is a potential result of simple depletion of hormones. So I cannot stress this enough. Bioidentical hormones are significantly better for you than a single one of these drugs, let alone being prescribed a laundry list of them because your practitioner didn't know any other solution that would be better for you. So just to kind of drive this concept in, Boston University School of Medicine, testosterone treatment as well as lifestyle changes can slow down or halt the progression of metabolic syndrome, type 2 diabetes, cardiovascular disease. Lifestyle changes. This is one of the things that separates us, is we're not just here to throw you on hormones and call it a day. That's how I work on my weight loss patients too as well. We do coaching, we have support, we have a community of men and women alike looking to optimize their health, and putting those pieces together, I think, are invaluable. Alzheimer's, neurodegenerative diseases can literally be improved and potentially helped and prevented with optimizing testosterone levels, because they see lower levels of testosterone being one of the risk factors that leads to those harmful deposits, which kills brain cells in large quantities. Significant improvements with testosterone therapy. Dr. Jonathan Wright from Oxford University, testosterone therapy improved the ability to remember, to concentrate, to have mental agility, while lowering and ending the moodiness, the irritability. So cognitive acuity, cognitive function, being sharp, being motivated, testosterone plays huge roles in that. Who doesn't want to be able to have the sort of mental sharpness you had in your 20s? I mean, this is quality of life, guys. And while hormone therapy isn't the only answer, I'll tell you right now, the second most potent thing to do with your testosterone, if you are coming to us, and this is what we do with our patients all the time, is a mega dose of DHA essential fatty acid, because DHA essential fatty acid also has huge improvements specifically to the brain with neuroinflammation. So these are just some of the little things that we do with our patients to help improve quality of life and maximize it, in addition to optimizing their hormone levels. So we've already talked about this, the lack of awareness from your doctors, the lack of awareness from society, the confusion that came from the WHI. This is why you were never given this option. And this is why this might be the very first time you're learning of hormone therapy, learning that it's actually safe, learning how efficacious it is. and learning that you now have an opportunity in front of you to get back the quality of life you deserve. So just to clear up some of the regulatory aspects of it. So the FDA does not regulate the production of bioidentical hormone replacement therapy because bioidentical hormone replacement therapy is not a drug. So these compounds are made at what we call compounding pharmacies, and compounding pharmacies are regulated by the Pharmaceutical and Compounding Accreditation Board. So each state has their own board, and these state pharmacy boards are regulating the compounding pharmacies to ensure highest quality and still adhere to standards set by the FDA. But the FDA does not regulate this. This is all regulated by state pharmacy boards. So how do we diagnose hormone deficiency? Well, you probably know by now it's labs. And these are some of the labs that we would look at. We want to get a good idea of what's going on with your overall health. That's the CBC, the CMP, the lipid panel, the A1C. Are you pre-diabetic? Is there a metabolic syndrome going on? So we get an idea of the woman's overall health, and then we look at total and free testosterone, right? We obviously got to look at estrogen, which we look at estradiol, and then we do a comprehensive thyroid panel, TSH, free T3, free T4, reverse T3. I couldn't tell you how many thyroid issues go undiagnosed all the time because their primary care physicians are only able to look at TSH, which essentially gives them a window view and not a complete view. Now, I'll tell you, all the labs are fine and dandy, but the medical history and the symptoms, the presentation of symptoms and the timing of whether they're not in menopause, honestly, is a stronger diagnostic criteria than labs, but it's nice to have labs because they confirm. Progesterone is something that you don't need to actually look at, which progesterone is that balancing act, that counter to estradiol. So any qualified practitioner understands this, that you don't, the progesterone level doesn't tell us anything on lab. It's what the estradiol and the FSH as well, which are levels that are precursors to the productions of our sex hormones. Bioidentical hormones are safe, efficacious. They don't carry the risks associated with synthetic hormones. And it's a damn shame that women have had to suffer for 30, 40 years, but you no longer need to suffer. You have options in front of you, whether you're working with our clinic, wherever you're working with, make sure you're working with a qualified board certified practitioner and somebody who has experience with women. I cannot stress that enough. Men are easy to balance out. It's a lot more difficult with women. And so you need somebody with experience. Our practitioners have been doing this for 10 years and they have a ton of experience working with both women and men in this space, optimizing not just their hormone levels, but lasting weight loss and bringing it all together so that we can achieve optimal health. Okay, so our two favorite methods for balancing our women out to provide them with the hormone levels that they need are creams and oral trochees. So creams are a cream, right? It's not a gel. It's more of a cream-like substance. And you can apply that to any areas with circulation. And sometimes, depending on the patient and their comfort level, applying them vaginally might even be the best route. This will be a conversation for you and the practitioner. What matters most when it comes to methods are what you can adhere to. Finally, our second favorite option would be oral trochees. Oral trochees are definitely more are new to the block, but they work very well. So you can look up oral trochee. It's a method of medication administration. You pop it between the gum and the teeth, and it sits there for about 10 to 15 minutes. And there's a breakdown and absorption of the hormones through what's called the buccal mucosa. The absorption is great, and the oral trochees are a phenomenal and very popular method. So whatever method it is, you'll have an opportunity to speak with the practitioner and figure out which option works best for you. Okay, so I want to talk a little bit about the functional side of things because I think it's really important to understand that in addition to your hormone therapy, there are other key areas and other key things that you should be doing to improve your overall quality of life. And these are just scratching the surface: supplements, your workouts, optimizing your stress and sleep. These are key things that we help our patients with, ensuring that they achieve higher levels of health. But supplements, I mean, look, this is the low-hanging fruit. Micronutrient deficiencies are very common. We just don't get enough nutrition from our food. So ensuring that we're taking supplements in the morning, that we're taking supplements in the PM, taking the right doses, having tailored supplements recommended to us by somebody who understands what's going on with your health and looking at the labs is going to improve the quality and effectiveness of your care. Getting into the best possible training, whether it be cardiovascular, whether it be resistance training, a lot of that will be set up by your goals. But I can tell you right now, 99% of the time, resistance training is the best method of workouts primarily, and you should be focusing on. And if weight loss is part of your goal, we're going to get into that here a little bit. Finally, optimizing stress and sleep is huge, because lack of quality sleep, extra stress in your life that you're not handling, that you're not counterbalancing with stress management techniques, not getting quality sleep causes spikes in cortisol. That stress response can, in many cases, override the benefits of hormone therapy. So we have to look at the big picture. And I think this is what really separates us from the rest, is that we include functional coaching. We have an awesome community of people both looking to lose weight and just optimize their overall health through bioidentical hormone replacement therapy. Okay, so finally, how do we approach this if we are overweight, if we are obese, if our health is in the gutter? It's one thing if we're just suffering with symptoms, but it's quite another thing if we're also poor metabolic health and suffering with obesity or any of these sort of inflammatory conditions like PCOS, or maybe even autoimmune diseases. So what I've noticed is that the extra body fat, the pro-inflammatory effects of the extra body fat can interfere with the effectiveness of the hormones. And so if you're going to start this therapy and you are in that category, you need to make the simultaneous agreement, both with yourself and with us, if you're going to work with us, that we want to tackle the weight loss, that we want to approach our overall health, because there's a lot of crossover between the things that are good for your health and the things that are good for your lasting weight loss. I have a ton of resources available to you as well on how to approach the lasting weight loss. So this is the sort of demographic and patients that we work with, that are people that are looking to bring their level of health to the highest point. And extra levels of body fat are part and parcel with roadblocks to optimal health. So we will definitely help you in that area, possibly even combine different programs depending on what your goals are. You'll have an opportunity to speak with your patient educator in the beginning, discuss your goals and your intentions, and we're going to get everything set up from you from there. If you guys enjoyed this video, then definitely you're going to want to check this video out here called GLP-1 Realities. This is an interview that I did where I took a deep dive into our lasting weight loss protocol. We use popular medications like semaglutide and tirzepatide, but what separates us is we actually help patients wean off, which is completely different than what's thought possible. For most people, there's this idea that when you take these medications and you stop, you're going to regain the weight. Not if you follow our protocol. So check out that video, guys, to learn more. And as always, we'll see you later.